have a fireside chat, so please eat, get seconds, get thirds, come on back, and we're gonna have a fireside chat that we're gonna get started with my very good friend, Mr. Patrick Wooten. Patrick and I have known each other over almost 15 years. And Patrick has been in the federally qualified health system world for over 20 years. And he has just built incredible organizations within multiple FQHCs focused on the patient, outreach to the family, and with excellent training and capacity building support for the teams that he has collaborated with. So in keeping with our conversation from yesterday, tying it from systems level development, I really wanted to invite Patrick to come and speak with us about what does it look like to build an efficient, continuous improvement team, and how do we scale those teams and ensure that we're doing more work with the resources that we have and honoring those resources so that they continue to be part of building out innovation interventions for our community. So Patrick, you are the Chief Operating Officer of Jane Pauley Community Health Center. You are adjunct faculty with Indiana Wesleyan University. You are a master educator on financial literacy. You have implemented medical missions in major faith-based organizations. What am I missing?
I was wondering who you were speaking with when you were that's a good summary of it all. And I would say good afternoon to all of you. It is delightful to be here today before you all, having this fireside conversation about continuous improvement efforts and what I would characterize as our relentless pursuit of continuous improvement and excellence. And so I'm delighted to be here today. Thank you, Sunny, for the introduction.
Thank you. So COVID-19, federally qualified health centers, where most organizations were looking at how do we move our staff home, you were looking at how do we move more staff in to support the crisis, really, of public health, this pandemic. So tell us a little bit about those early initial challenges.
Yeah, absolutely. But I feel led also to just kind of characterize the Jane Pauley Community Health Centers. Jane Pauley was erected in 2009 under Community Health Network. It started with one site location. And of course, Jane Pauley herself, the figurehead that we all know in CBS Sunday this morning, was approached because she was a Warren Central graduate. And they wanted to name the health center in honor of her. And of course, she's been quite vocal with her struggles with behavioral health. And so, of course, she cried, and then, of course, that one health center started, and now fast forwarding 13 years later, we're 12 centers across 4 counties in and around central Indiana. So the question that you posed, it was a very heavy lift to make sure that we would really underpin the catchphrase that we have is meeting the needs for our communities that we serve. And we really wanted to make sure that we stepped up in the eye of that pandemic when it first rolled out.
13 years, 12 centers. Wow. Where newly have you opened?
Yeah, so our newest location that we have that we've opened is our Castleton location. We have a cluster of sites here within Indianapolis, really nestled toward that Warren Central Township area. And then, of course, the newest site is Castleton location. Just to kind of speak about the other counties, Madison County, we have a cluster of 4 sites there. And then we also have sites in Hancock as well as Shelby County, which is in Shelbyville, Indiana. So we're very dispersed throughout Indiana.
I love the rural, suburban, urban mix, and I know our health equity community health workers in those counties will be ensuring, yep, we got a table of head nods, will be coming and getting your contact information shortly. Patrick, coming back to the expansion of teams, not only physical facility, but specifically new individuals coming on board, those that had FQHC background, those that did not, those that were newly into the workforce. tell us a little bit about how you specifically, as a leader, as a chief operating officer, how you messaged continuous improvement and how you got your team to buy in.
Yeah, well, like any great organization, of course, as you've alluded to, we grew very quickly. Sometimes your processes don't grow with you. And so we sometimes operate like we had one site when we're now 12 sites across 4 counties. And so making sure that we really looked at those operational issues that we had, to really look at them not as problems, but as opportunities for us to advance and grow so that we can better meet the needs of our population. We really had to take this framework to say problems are opportunities. And any great organization that you have, you're going to have those opportunities. Also, the leadership mindset that we have to stop reacting, but we have to respond to things because that's a more paced approach. And that actually is on slide 2. I'm not quite sure if we're following along with the slide deck here, but we can actually migrate to slide 2 so we can see some of those elements. But also, problems are the forerunner of excellence. Again, as we look at continuous improvement, we want to look at our problems or those opportunities as a forerunner for getting to that relentless pursuit of excellence.
Tell us a bit about what we're looking at here. It's very bad with a bunch of Post-it notes. What is this?
Yeah, so, one of the things when you look at continuous improvement, you want to make sure that all of your leaders are on board. I think we have a lot of agencies here that are represented in this particular conference. And if you actually go down this pursuit of excellence, you have to have widespread leadership adoption because, again, that's going to cascade down. You can't have one person within the organization starting this and then hoping that that wildfire catches on with others. So you want to make sure you have leadership support. But this rendering that you see here is a strategy operations session that we had with one of our stakeholders that's a major vendor that we've been working with. We had a session where we locked all of our managers in one room and with a bunch of sticky notes. And we wanted to really make sure that we looked at what those priorities are for our organization. We wanted to look at those from the strategic perspective and also in terms of the activities that actually are subsumed under those as well. So when we came out of that room, we had 3 major priorities that we were going to work on with 5 corresponding activities to every one. So that was 15 activities that we wanted to make sure that we progressed through for the year. And so the notion was that they wanted to know who was the responsible party. And so all of the sticky notes got stuck on my back. But we quickly disseminated that so that it's a shared vision, and our managers are participating in that as well.
I think it's so powerful to look at the visual impact, right? So we talked about yesterday your crew. Your crew absolutely extends into your colleagues as well. And whether or not we are communicating well with our colleagues to say, I see what you have to do and I understand and I acknowledge it. And here's what I have to do and here's how that intersects. And here is how we can help each other collaborate, make it more efficient. And ultimately, that becomes your daily behavior towards continuous improvement. And I love that your whole team literally put those Post-it notes on your back to say, we see you as the one responsible, but we are accountable to you to ensure that you also are able to complete that. And with that incredible team, the accomplishments speak for themselves.
Absolutely, and we are progressing through those activities, and many of those activities are already complete, and we still have 1 more quarter left of the year, so we're progressing through those activities. But again, the root of it all is having that relentless pursuit of excellence. That's a term that we coined that helps motivate us as we progress through this journey as well. Slide number 3, and I know we'll talk about this as well, is really having that modality or that system in place to help us with it all. Who's heard of Six Sigma before? Absolutely. So a good part of the room has heard of Six Sigma. Again, it originated out of manufacturing, made its way in healthcare and other sectors, and that really is the engine behind it all. We've adapted it just a bit because we didn't want to make the relentless pursuit of excellence hard for our leaders. This was a foreign term for some of our leaders, And I will say, as we kind of unpack this particular slide study, that it's a recommendation, highly recommendation, I call it non-optional. You know, they say that at the organization, that every single leader is enrolled in continuous improvement, because as a leader, we solve problems. We get paid to solve problems. And the higher that you are, high visibility, high vulnerability. And so we want to make sure that all of our leaders are equipped with the tools to really help teams progress through problems and solve those problems.
You know, you are what I would call the epitome of a leader who leads to learn. And you're a phenomenal listener, and you are hyper concentrated when you're looking at the issues and evolving them into opportunities so that your team can buy in. How many times a week do you meet with your team?
We meet probably too much. For every Monday, we have what's called a director's huddle every Monday. We meet with all the directors to make sure that we focus on priorities for the week. Corresponding to that, after our directors meeting, we have our managers huddle. And again, we're dispersed, so we're all around central Indiana. And so all of our managers actually meet as well. But to that end, at the end of the week, we have what's called a leadership forum. That's every single person within the entire organization that has any reference of leader in their organization, in their job description. They actually meet with us for an hour as well. So again, it's that continuous improvement of communication, and also making sure that every leader is on board and understands what's going on within the organization. We see so many challenges in organizations of not having the understanding of what's really going on. And so you see these different rabbit trails that are happening. And so we want to make sure that we pull everyone together to make sure that everyone understands the overarching goals, what's new, what's to come, and of course making sure that they have that alignment to those goals as well.
Earlier, when Minister Alexis Nelson was inviting us to her site, my first thought was the miles that you've put on your own vehicle in establishing these new sites and meeting with your teams and so forth. So can you walk us through like a typical week prior to everything, before it became an accomplishment and steady state? What was it like beforehand?
Yeah, I'd say it's still, when we say relentless, it's still relentless. With COVID here, being still here, and of course, even before that, 40% of the job is travel. So, you know, door-to-door time on one of our sites, Alexandria, Indiana, is one of the furthest sites away from my house. I live in Irvington, so I live very close to here. And that's about an hour away. So, you know, there's a lot of drive time, but it's so rewarding when you see the difference in the communities that we serve. If you look here in Indianapolis, there's a lot of healthcare organizations here within Indianapolis. Eskenazi's here, you know, other FQs are here too. But when you go out to the rural counties in Alexandria, some parts of Shelbyville and Anderson, we are the only ones there. And that's who they look to. And so we have to make sure that we have processes in place to really support the communities that we're serving. And we can't do that by window dressings. We just can't say we're doing it. We have to demonstrate that we're doing that. And how do we do that? Is making sure that our leaders are aligned and our teams are aligned as well.
And with that, you mentioned that you've gone through so much leadership building, honoring folks to kind of self-select to be part of the leadership forums. And those are all positive, good connotations. Talk to us a little bit about when there isn't a right fit, when the culture is evolving, but the manager is not. Or when the community is changing and we have more patients and we're just seeing that those in the office really just are not accepting of or are almost putting up barriers to change. How have you dealt with some of those personnel challenges from an HR perspective?
Yeah, so my linear person is an educator, of course, and we talked about that. A lot of my education and training is in education. What I've learned in my experience is that You can definitely teach a person about your processes. You can teach them how to navigate through your complex EMR systems. But you can't teach them how to care. Either you have that or you don't. And when you look at our mission statement and our values, it's really extending to meeting needs of a population that's very vulnerable. And if you don't care about that, we have a big problem. And of course, our patients can detect that too. They have high discernment of detecting those types of things. And so we have very difficult conversations. And a lot of those individuals opt out because the mission is so strong that you would stick out. You won't stand out. You're sticking out at that point as a leader. And so we've had leaders who have opted out of that. We really try to hone in on that during our interview process with leaders of talking about what is the mission, vision, and value of Jane Pauley, and making sure that individuals understand and know that, and that you sign off on it as well, because this is what you're signing up for as a leader. So we want to make sure that we're supporting that. You have to care.
You know, it's just magnified that you not only are a manager with the title of Chief Operating Officer, but you really care about your people. And when we first talked about the COVID-19 impacts and this data storyboard, you went first to your team, your personnel, training, how you gave folks more just really education, support in the time through COVID-19. I was looking for stats like, oh, we served these many patients, and we did this, and then we improved these processes or these services, but you really went to the heart of it and said, for our teams, for our people, we acknowledge, we recognize, we honor the fact that they're doing essential work, hard work, and relentless work that is always supportive and focused on the needs of our communities. So just kind of tell us, really in kind of almost the true data visual, if you will, and this is a precursor to next slide. What does that really look like from the true growth and transition of a pandemic, a crisis, truly evolving into an opportunity?
Absolutely. So you'll see on the slide here is, and we'll progress forward to answer that question, our continuous improvement model. This is the model that we ascribe to. Again, we've talked about Six Sigma. You have to be very organized when you deploy these types of things. And so we want to make sure that our leaders buy into this. We've also had emerging leaders come to me and say, hey, I really like this movement. I subscribe to that philosophy. I want to do this as well. And then, of course, if we can just skip to the last slide, the very last slide, and then we'll come back to the second to the last. This manifests itself in visits. And so if we can look at that last slide, you'll see kind of a chart that will talk about the growth. Now, we all know when COVID-19 hit, right? And so this depicts what continuous improvement will do if you really lean into it and you really are serious about serving the community. During that time, in COVID-19, we had 91,000 patient visits, and of course 25,000 unique patients as well. But if you look at that line, that exponential increase of how we've actually tipped up 94,000 in 2000, and then in 2021, we cracked for the first time 100,000 patient visits within the centers that we have here within Jane Pauley. And so again, you can't do that without being intentional about your efforts. You want to make sure that you're focused. I will tell you, telehealth was definitely our friend during the pandemic because not only were we in person, but we were online via Doxy.me as well. And so we had providers that were engaging into healthcare with our patients. One of our largest service lines is behavioral health. And of course, we would definitely need that during that time because that was an intense form of trauma that was going on out there. People were grappling with the fact of how do you deal with COVID-19. And so we did see our numbers exponentially increase for counseling services, as well as our PMH and Ps as well. So BH is definitely a vibrant service line that's live and well. Unfortunately, the only service line that we did not see that increase in is dental. at that time, we actually had to pull down some of our dental services while we understood more of the impacts of COVID-19. So the dental service line went down, behavioral health went up, medical services went up, and OB services went through the roof. So I guess that has its own set of thoughts to it.
Well, I think that is phenomenal that there was expansion in services, expansion in team members, expansion in direct-to-patient interaction engagement. I know you guys have updated your logo, revamped your website, huge improvements in patient satisfaction surveys, the way that you do outreach, all of these functional things. But truly, it's been a message of we care, and we're showing that we do the work with care and compassion throughout that's generating this incredible growth. So my hat's off to you, Patrick, and the team of just continuing to really understand what the community needs, sans community health needs assessment, but really through intake and clinician approaches and really your outreach team.
Thank you so much, Sandy. And if we could go into that second to the last slide, I'd be remiss if I didn't really talk about our team and some of the improvements that they've done through COVID-19. So that's just a reflection of some of those projects that have actually come through the Yellow Belt certification program that we have, that individuals have actually leaned into, and that we've been able to make sure that we looked at those particular processes that they developed during that Yellow Belt certification, and that we actually make those pervasive throughout our organization as well. So we, again, this was not just certification, giving an individual certification and training. We wanted to make sure that we were able to glean some of that insight as well and be able to actually perpetuate that throughout the organization. And again, they call this my tattoo. I don't have any tattoos. I don't have anything against tattoos. But during Yellow Belt certification, everyone receives a plaque. And the plaque reads that excellence is never an accident. It is a result of high intention, sincere effort, intelligent direction, skillful execution, and the vision to see an obstacle as an opportunity. And so that's really something that you'll see on every leader's desk. And it's really a reflection. It's almost what they call a vision board to remind you why you actually went into this work.
I love the continuous communication, the visual vision board, and just the care and compassion that you evoke as a leader to your team on a daily basis to make them better leaders, better clinicians, better team members to really transform our healthcare systems. My hat's off to you and your team in demonstrating and sharing with us what really the definition of health equity as you continue to do the work, but also are able to share so uniquely packaged in each of these bullet points, but so much work going into each and every one of those line items, how you guys are truly making sure that equitable access in our health systems work is being provided on a daily basis. Can we honor Patrick and his team that's on here today with a round of applause for their fantastic work. Patrick, anything else that you'd like to share with our collective of wonderful health equity partners that are assembled here today?
No, not at all. Just say keep doing the work. Always available if I could be of any assistance to you as well. This is definitely not easy work to do, but it's rewarding, and so for that I'm grateful.
Mr. Patrick Wood, thank you so much for being our fireside chat leader spotlight at this Minority Health Partners Conference, and we continue to look forward to learning from you and your team on further continuous improvement models and frameworks. Thank you, sir. We are going to take a 10-minute break, a stretch. Please use the facilities and so forth. We're going to be back with Anastasia Ogutande with the Indiana Black Breastfeeding Coalition, just a few updates on the wonderful work that they're doing and the recent grants that they've won. And then we will be connecting with Dr. Sophia Wang at the IU School of Medicine on their Alzheimer's research. And so please take that 10-minute break. We'll be back at 1:10. And thank you again to Mr. Patrick Wooten for being here today.